Good evening, everyone. We just have over 250 people on the webinar at the moment, so I think we'll go ahead. I'm conscious we're very thankful for you giving your time to us this evening, so we want to fully respect that and go in line with the timetable we've set out. So that's from 7 o'clock this evening until 8:30 p.m. Last week, I guess we focused primarily on the changes to prescribing requirements under Regulation 2019-6, with presentations from the department, from the Veterinary Council, and from Animal Health Ireland. And I think possibly the single loudest message we wanted to get across was the very strong focus EU law is now placing on the prescribing, dispensing, and usage of antimicrobial medicines. As Finola McCoy highlighted, the WHO estimate that if AMR is not addressed, it will be responsible for 10 million human deaths annually by 2050. So that's more human deaths than cancer. That is why addressing AMR is to the forefront in EU policy, from this regulation to farm to fork, and it's also specifically highlighted under the CAP's new eco schemes in Pillar 1. So it is really to the forefront in international policy. This week, we're trying to broaden the presentations into other important aspects of the regulation and also the Medicated Feed regulation. And as I mentioned last week, the department, along with the Veterinary Council and the Health Products Regulatory Authority, are the three competent authorities responsible for the regulation and oversight of veterinary medicines and the practice of veterinary medicine. The role of the HPRA is to make sure that veterinary medicines are as safe as possible and do what they were supposed to do. And effectively, I think it's like the old Ronseal ad: the medicine is supposed to do exactly what it says in the tin, and the HPRA are responsible for assessing that. Gabriel Beechner, who's presenting first tonight, has been with the HPRA for over 30 years and has been Director of Veterinary Sciences within the HPRA since 1999. So Gabriel brings vast experience and knowledge from his experience, engaging at national and international levels. Given the importance of agri-food to the Irish economy, having a stable supply of veterinary medicines that work is critical, and the HPRA are central to ensuring this. The next presenter is Paul Corkery. He is the Senior Superintending Veterinary Inspector here in the department and is the Veterinary Head of Veterinary Medicines. He'll touch on other aspects of the regulation outside of prescribing, such as wholesaling, advertising, disposal of medicines, and among other issues. Our final presenter, Eva Gettings, is a veterinary inspector here in the department dealing with veterinary medicines and residues. She will provide an overview of the changes associated with the new Medicated Feed Regulation 2019-4, which would be of particular interest to vets dealing with the more intensive production systems, such as pigs and poultry. Again, addressing AMR is a major objective of this regulation. And just, I guess, to repeat my own background, my name's Colin Ford. I'm Head of Veterinary Medicines from the admin side here in the department, and my division works hand in glove with Paul and his team on the veterinary side. So look, I won't hold you up anymore, and I'll hand the floor over to Gabriel, who will speak about the HPRA's role in terms of this new regulation and in terms of the regulation of veterinary medicines in Ireland. So over to you, Gabriel.
Thank you, Colin. Hopefully you can see my screen now.
Yeah, we can, yeah.
Okay, perfect. Thank you very much. So I've been asked to address the topic of the EU regulations and what they mean for you from 2021, actually. So just to remind you what our role is to protect and enhance public and animal health through the regulation of medicines, veterinary medicines, medical devices, and other health products. And probably most of you would be familiar with how veterinary medicines are regulated in this country. So the HPRA looks after, if you like, the products from point of manufacture. So we authorize the veterinary medicines, and then we also monitor the safety of the products afterwards through pharmacovigilance or adverse drug reaction monitoring. And you see some of that today through the COVID vaccines on the human side. And then the Department of Agriculture, DAFM, regulate, if you like, downstream of the manufacturers, so wholesalers, distributors, retail use, cascade provision and compliance. And they are also responsible, the custodians, for the national legislation. So in looking at the legislation, it's important to understand maybe the drivers of change, and then we will look maybe a little bit in more detail at the regulation itself from a practitioner viewpoint, and how it's been implemented in the EU and what the next steps in its evolution will be. And then finally, we look at some national issues. So this legislation was actually in the pipeline for a long time. And in 2014, there was an impact assessment. And at that time, and indeed currently, you can appreciate that there was a lack of veterinary drugs, in particular for minor species, or for rare and emerging diseases and minor indications in major species. Also, there was a recognition that unlike human medicines, the market for veterinary medicines is paid for by private funds, and return on investment is key to making new products happen. The market for veterinary medicines is multi-species and plurinational. So basically, it's a very fragmented market. And consequently, the administrative burden on the animal health companies is about twice that of the USA and other countries. And another point, which is a separate one, but it's an overriding theme into the new veterinary regulation, is the fact that addressing AMR, antimicrobial resistant, the tools that we had in place at the time were not sufficiently agile to allow the regulatory world to move on. So in other words, if we saw a problem and we wanted to introduce new indications or new warnings on a product, it took maybe a year before we could get a uniform agreement to do just that. So we've had since 2019-6, which is called also the new veterinary regulation, that set out to provide what's called fit for purpose legislation. Previously, the legislation we had in the veterinary world paralleled that for human medicines, and that was seen to be basically to be overly heavy in terms of administrative burden. So this new regulation is modern, it's innovative, it's lean, it provides incentives to stimulate innovation, and I'll detail some of those. It gives incentive to increase availability, and it strengthens, as I say, the EU action to fight antimicrobial resistance. I wrote about this, so some of you might kind of already have read this article, which was published in the Veterinary Journal Ireland in 2019, and that spoke about incremental rather than radical procedural changes, but nonetheless, some of the changes are really impactful from a practitioner viewpoint, and I'll detail those this evening. So the new regulation expands the scope of the centralized authorization procedure. And what that means for you, I guess, in practice is that anything new in the future, innovative medicines will all come with an EU license number rather than a VPA authorization number. Secondly, the way is now open for generic medicines to all be licensed either through the national procedures or the centralized authorization procedures. And previously, the companies didn't have such choice. There'll also be a facility for companies to, if you like, build out authorization. So if they've only got a limited market, or if there's a rare disease, they can license a product and gain data, post-marketing experience, and then build back, if you like, in the indications, or a conditional authorization where they can, as I say, meet the condition and convert that ultimately into a standard authorization. So it allows more possibilities for companies to get authorizations and to reach the market quicker. There are other effects, and I'll detail more of them too, but the text on product labeling will be reduced. And the idea there is to focus the information on the package leaflets, because the package leaflet can then be produced in a multilingual way, which means that the batch sizes for Europe can be expanded. There is a change in how medicines agencies monitor adverse reactions, and I'll stress the importance of that later on and why that's important to you. There are changes to data protection. Basically, innovation gains extra years protection. And then there's a creation of a union product database, which is a singular major development, and I'll explain that momentarily as well. So on this slide, this depicts the various, if you like, cogs in a very complex system. So we have the EU regulation with, in this slide, the EC stands for European Commission, EMA stands for European Medicines Agency. And outside of that, then we have influences from that, if you like, that nexus on IT systems, on revised regulatory procedures, and to understand as well that this regulation also enables secondary legislation. So these are called implementing and delegated acts. And these affect all the stakeholders that you see here, including yourselves as veterinarians, but also pushing out information to the general public, and that will bring its own hazards. And I'll describe some of that when I go through. So this regulation was approved in 2018. It was published and became effective in 2019, and there's a 3-year application period. In other words, it becomes applicable in January 2022, or goes live from January 2022. And during that time period, there are 20 implementing or delegated acts. So these are secondary, if you like, details which must be fleshed out in the intervening period. So just looking at the IT elements alone, and these are fairly fundamental, and underpinning them is this union product database, which will provide information in respect of all authorized veterinary medicines in Europe. That amounts to more than 30,000 separate products in the EU. And that will be available and visible to everybody in the EU. There will be a union pharmacovigilance database of adverse reactions, and I'll describe that later on. There's a union database on manufacturing and wholesale distribution. And there's a database on the collection of sales and use data on antimicrobials in the EU. And I'm not going to speak further about that because Eva Gettings, who's on the call this evening, will be presenting on that topic later on. So this is what it looks like in terms of concept. You have this, as I say, central to the whole lot is this union product database. And also you can see public information. And again, like not only you will be able to search for products, but so too will the public. Not only you will be able to look at information on adverse drug reactions, but so too will the public. And sometimes they will possibly come to erroneous conclusions about what they see and what they think as a result of the information they see. So the Union Product Database, at the moment, the EU is delivering what's called a Minimum Viable Product, MVP, which is basically what computer system is necessary to deliver the minimum requirements specified in the regulation and associated implementing acts. But just you can see, if you like, in the complex box in the center there, the UPD portal. So this will be a system which will allow data searches, which you can export. There'll be some analytics. There are some areas there for manufacturers that they can, if you like, directly feed information in to save them having to submit information into each national competent authority. And there's also a data repository where the marketing authorization holders can directly intervene, and that will lead to enhanced data quality on products, in addition to other functionalities such as document management and document history. So this database, as I say, will contain information on all veterinary medicines authorized in the EU. So we're talking about the summary of product characteristics, so indications, target species, withdrawal periods, precautions, everything. And that's right throughout the different member states of the EU. It will also contain information on registered veterinary homeopathic medicines. It will contain information on parallel traded veterinary medicines. Parallel traded veterinary medicines are a little bit of a nuance. But for example, if a medicine is authorized in another country and the same product is available here, but it's more expensive, then a company may decide to parallel import that product. They will still need to authorize it, and they get a parallel authorization for that product. But that information will also be on the European database, and there'll be information on medicines allowed for use in exotic pets. This is again a niche area, and I have one slide towards the end where I'll come back to on that. I won't describe the other areas in that are mentioned here because they're really towards companies, how they manage applications. But as I say, there is a feature there where there's enhanced transparency and access around the whole portal. So the EU currently is developing up with these databases. They're on a time frame to develop them. And if you take the Union product database in dark blue here on the screen, the first prototype of that has already been built. So there's a proof of concept. And the next job of work for us in the NCA, the National Comp Authority, the next job for us is to load our national product data onto that European product database. So for Ireland, that means exporting 1,900 products from our national database into the European product database. And for many member states, they have to export more or less the same number, or indeed in some of the bigger member states, upwards of 3,000 or 4,000 products to the European Centre database. Significant as well is the fact that there are foreseen to be a number of post-MVP improvements, that's minimum viable. In other words, even after go live of the new system in January 2022, there will be a series of additional go live improvements to the databases foreseen to run on to 2023 and probably beyond. So again, you know, this system depends, the functionality of the system depends on all member states exporting the data to the portal and for that to be up and running by January 22. If the member states don't provide the data, then some of the functionality that's expected and some of the efficiencies for industry will not be realized. So there's a big push on currently to prepare our data for export to this UPD. As I say, the UPD it's called an Agile Development, which so the system is still being, if you like, designed as it is being built. And for us, that causes a problem because in order to export the information from our database, we need to have, if you like, fixed the detail of what's required. And at the moment, the implementation guide is not yet finalized. So until it is finalized, we can't actually develop our own what's called business rules for submission of the data across the EU Centre. So there's an awful lot of work ongoing right now to try and deliver the data as required. And this data then will underpin also the Union Pharmacovigilance database. And this is a database of adverse reactions. And there is already, a system that has been developed. Again, the box in the center there looks at development, data analytics, searching tools. So you could be able to go and search the adverse reactions associated with a particular product and export that to your own system. And there are other tools for companies so that they can manage and we can manage as authorities. We can manage signals from the system, and we can also keep a record of pharmacovigilance inspections of companies to ensure that companies are recording the signals that are coming into them from vets throughout the EU and beyond, and putting it into the system so that they can meet their obligations, and we can, if you like, mine the data in real time. And again, there's a significant focus on data repository in terms of the data quality and document management. What the system is moving towards is called a signal management process. So currently companies provide data, if you like, historical data, typically in a period of 3 years. So basically what has happened in the world in the last 3 years, companies are obliged to provide a report on that to us and to see if the benefit risk has changed and if the adverse drug reaction information needs to be updated. But from January 28, 2022, the companies will no longer have to do that. They just have to report their signals. In other words, adverse drug reactions which you report, they have to put that into the system within 30 days of them receiving it. And then the companies and ourselves must monitor that in real time to see if the benefit risk balance has changed. And if so, then we need to amend the warnings or take other regulatory actions. But a significant feature is that currently there's a requirement for us and the companies to have a causality assessment. In other words, is the reaction that you've experienced or the animal has experienced, is that linked to a product, yes or no? But in the future, the information is just reported in, and then through a system of algorithms and so on, we're meant to, if you like, do our own assessment, but it won't be a classical causality assessment. It will be, if you like, a trend analysis based on signals coming through, and we'll have to differentiate, if you like, false signals from real signals in real time. The process will have to be further mapped out in terms of good pharmacovigilance practice guidelines and EMA guidelines. But again, to say that the public will have access to certain information fields. So if they think that their dog has suffered from an adverse reaction, they may well come to you and say, have you seen this database and see the number of reports there are associated with product X? So again, you need to be able to know where they're looking and have your answer prepared accordingly. There will be significant changes to the summary of product characteristics, and the labeling of products is very substantially changed. And that will apply from the 28th of January 2022, so from next year. And all existing products will have to comply with the new regulation by January 2027. So a 5-year period is given to bring everything up to date. So in terms of the SPC, there'll be some changes to, for example, the way information on adverse drug reactions is mentioned. So currently the signals are written down as common, rare, very rare, and there'll be some changes of that to make them more useful, that you can read across different products in a more standardized way. There will be standard sentences associated with correct administration of products. There will be, and I'll come back to this, particularly for antibiotics under 3.11 here, restrictions and conditions arising from, if you like, these are cascade use especially. There'll be standard phrases required for if a product is licensed for a limited market or under exceptional circumstances. Basically, you will know from the SPC that this isn't a conventional authorization, that it's subject to, basically a limited market or for the provision of new information or whatever it is. Whatever the condition is will be listed on the SPC. There will also be information on disposal of the product and information on whether the product is prescription or non-prescription in the EU. As I said, there will be significant changes to the immediate labeling of the product as well. And here you can see items which will disappear. A couple of ones I want to highlight to you this evening. The marketing authorization number will no longer have to appear on the immediate labeling. The restrictions on the supply and use, in other words, is this product POM, LM, or whatever, that will disappear as well from the labeling of product. And where will it appear? It will appear on the package leaflet. We're moving as well to a series, you can see the icons here. So instead of calling out cattle, there'll be a picture of the cow. Instead of calling out a dog, there'll be a picture of the dog, and so on and so forth. So again, the idea here behind this is that we're moving towards a product which can be released with minimal textual information, but is understandable as it is throughout a great many member states. And basically the national language requirements will be housed on the package leaflet. And even the package leaflet, there's a provision that it could be provided electronically. So it's up to each member state to decide how it wants to implement that requirement as a physical package leaflet or as an electronic package leaflet or both. So as I say, the outer label text is reduced to a minimum of detail. The method of sale and supply and the authorization number will be removed. The classification category, there won't be a category higher than POM. In other words, the veterinary practitioner only category will disappear from the nomenclature on the product. It is, however, permitted by the legislation, by the regulation, for products in the categories non-POM, if you like, non-prescription, so that those categories can continue to exist. So the LM, CAM, pharmacy sale, etc., they can continue, but not any category tighter than prescription only. The product classification, it can continue to be defined by member states, but there is a central coordination still. So basically you can see more harmonization throughout the EU in terms of prescription or non-prescription. And as I say, there's a choice for member states whether they want to have an electronic packet leaflet or not. Even though a lot of effort is being put in currently into developing the secondary legislation in the period between now and January 2022, please understand that actually, as we move through to the next few years, there is a requirement for yet additional legislation. And you can see here, P3 stands for Package of Information 3. There is information on the pictograms, abbreviations, equine identification, list of essential substances for equine species, and then within 5 years, list of substances which are maybe used for aquatic species. So this isn't just a big bang approach in January 2022. There are a series of additional measures which will come into play in the period of time between now and 2027. So I've taken this slide from a presentation from the European Commission in last month, in fact, and they concluded that overall the work is progressing on time, and the European Commission maintains its ambition for the timely implementation. So in other words, and maybe it's a bit like the COVID vaccine rollout, you know, there maybe have been some time slippage up to now, but we're roughly on track and it'll be all right by the time we get to January 2022. There are specific issues around antimicrobials, and I know Paul Corkery will deal with the national actions around antimicrobials shortly, but I just want to highlight from an EU point of view, this is some of the secondary legislation around that will affect how products are being used in Ireland. So at the moment, there's effort going into an implementing act, or a designated act, a delegated act, sorry, which is around the criteria to designate antimicrobials reserved for humans. You know, so you'll be familiar with critically important antimicrobials, and so the EU is developing the criteria. Once those criteria have been finalized, then individual substances reserved for humans will be entered into another legal instrument by way of an implementing act. So the criteria are developed and published first, and then the different compounds are assigned to different categories depending on their importance for humans. And then there'll be a list of substances that cannot be used under the cascade. So currently you're familiar with the cascade, provides for exceptional use of products outside the terms of the SPC, but in the future, certain antimicrobials will not be allowed outside of the SPC, or will be allowed subject to certain conditions. And again, those conditions will be defined. So, and that will be defined between now and January 2022. There is also a requirement for updating of the SPCs for antibiotics to remove preventative claims. So again, this is a significant restriction on the use of products. Some of these are legislation, but then CVMP itself has developed a strategy on antimicrobials, which was published last month, and it's available on their website. I'm not going to speak very much about it. I'll highlight in my next slide maybe some of the important parts of it, but it's a 5-year strategy around antimicrobials, which is designed, if you like, to preserve the microbials we have, but will have the result of restricting some of the products concerned. And then separate to that, again, you're probably familiar with the farm to food strategy that the EU Commission has announced, where it foresees a reduction in the sales of antimicrobials by 50%. It's not clear when you look at the data whether that's compared to 2020 or compared to 2019 or 2018. But anyway, it's an ambitious target, whichever date is chosen. Just in respect of the CVMP strategy, and CVMP is the Committee for Veterinary Medicines that operates under the aegis of the European Medicines Agency. 1 or 2 points to note, because it will impact ultimately on some of the older antimicrobials. There is an initiative to look at the dose optimization for older antimicrobials. And so we know that from our experience that and reports of lack of efficacy, that for some of the antimicrobials which are around now for 50 years or more, they're no longer efficacious at the dosage that they came to the market at. And indeed, the dosage that underpinned those products first day was probably regulatory light by today's standards. So, but rather than get the companies to develop up new studies, this is an initiative to try and, if you like, data mine from literature and from studies that may exist in the wider domain, so scientific conferences and so on, to try and see, can we look through, if you like, the available data, so without putting any additional burden on the companies, can we basically look at some of these studies and say, actually from a pharmacokinetic, pharmacodynamic model, that the dose, we could increase the dose, maybe increase it by 50% or whatever, and make it more effective in terms of today's standards. And, you know, at the same time, we would have to change the withdrawal period, perhaps, and look at other aspects as well, user risk assessment, environmental impact as well. But nonetheless, there is a feeling, and there's been a pilot study done on this, looking at some products for pigs to see how this would work. And there is a, if you like, a proof of concept already done. And this is an initiative that EMA is looking at to see whether we can help to bring better dosages to some older antimicrobials. If a company should come up with a new antimicrobial, and you know, this is a bit of a holy grail because very few companies are working in that sphere, because they fear that if they did come up with a new antimicrobial, they'd be rewarded by an ultra conservative indication, which means that they probably wouldn't have much money back for their product. But one of the requirements is that before they would even embark on building out a dossier for a new antimicrobial, the CVMP would do a risk profile to, if you like, describe the type of studies that they would be required to submit. So if the company has a candidate, a promising candidate, they will effectively ask the EMA what studies do they need to prove the profile of the product, and see if it's to see what kind of risk management measures would be needed. Risk management measures are, for example, post-marketing requirements. So this would typically be, for example, a requirement for the company to monitor the use of a new antimicrobial, monitor the build out of any resistance, and so that we could, if you like, tailor the indications for use based on post-marketing experience, and refine any warnings and so on. There's also a reflection on alternatives to antimicrobials. So looking at, you know, not only vaccines, but also enzymes and other immune enhancers, other types of compounds which may become available, which will, if you like, assist the body's response to microbes. And then there's a reflection on antimicrobial resistance in the environment and what contribution veterinary medicines makes to that. So again, what we're looking at here typically is the intensive livestock sector, how products are being used, how much ends up in the environment, and if they do end up in the environment, this is having passed through the animal, what is the risk for humans after that, and how can it be mitigated? And then environmental considerations are becoming a significant driver as we approach the next few years. You're aware that zinc oxide in veterinary medicines has to be withdrawn by June 2022. And that's used in the pig industry quite substantially, or has been used in Ireland and the UK in particular. There is a risk that as it is withdrawn, there could be a need for even greater use of antimicrobials unless we develop up alternatives. There is also an ongoing European Commission study to look at what's called eco-monographs for active substances used in veterinary medicines. And this is seen as one way for companies to maybe like pool their data on individual substances to ensure that not everybody that's developing a new veterinary drug has to provide its own unique, if you like, environmental impact assessment for its active substance. There is a concern as well about what's called PBT substances, persistent bioaccumulative toxins, and their impact. And certain antiparasitic compounds in particular are seen as giving rise to substantial impact on the environment. And that impact is foreseen to be not only local, but if you like, worldwide, and to basically contribute into the other toxins that might be in the environment. And so there's an effort, if you like, to eradicate, in fact, some of these toxins from the environment, and that may well take down some antiparasitic veterinary drugs in the near future. There are concerns also about the runoff from antiparasitics in the environment, and particularly you may be aware that a study in the UK where some rivers were more or less denuded of fish, and when they investigated, they found that this was caused by antiparasitics getting into the waterways, and these antiparasitics were getting into the waterways, if you like, via animal use. So animals that were either dipped or were treated with veterinary medicines, and their excreta or their residues from the drug itself was getting into water courses and effectively decimating, for example, the mayfly, and then the fish that need to feed on the mayfly are no longer in the environment. So there is a concern around that as well. So effectively, the authorization of a medicine depends that the benefits outweigh the risks or harms. And you can see that some of these risks are becoming better understood, and we're trying to delineate the benefits more accurately in the future as well. So the future evolution of the system, I see that there will be increased innovation in veterinary medicines. I think that there are new data protections. Across the board, there has been a reward for new innovation in the new regulation to a maximum now of 18 years. So these are significant. Whether they are going to turn the tide, I expect that they will do in terms of being significant for the companies to invest. I've mentioned that there would be increased transparency from EU databases, but bear in mind that it's not only increased information for you, but also for your clients, and they may not be as tuned up. So for example, if you find that there is a product that's authorized for an indication in Greece, for example, in the European product database, how is that going to measure up in terms of it won't automatically be available to you. Even if you know that there is a suitable product authorized in Greece, you will still have to organized to have that product imported into this country. So that is a significant barrier in its own right. Also, even if a product is available in terms of the EU database, it doesn't mean that it's available when you go to purchase it. You know, we can have a situation where a product is out of stock for whatever reasons, production reasons, there was a high demand in that country or whatever. So, you know, again, these nuances won't necessarily be understood by the lay audience, but you should, as veterinarians, you should be aware of that. I've mentioned adverse drug reactions. There will be increased monitoring of the use of veterinary medicines, and I think Eva will be dealing with that topic presently. I mentioned the reduced information on product labeling in favor of the SPC and package leaflet, and greater impact on the environmental impact of products. Just concerning national issues, we've heard the topic of veterinary prescriptions and dispensing controls last week. There is a requirement in the animal health law around, which is a regulation that was elaborated in 2016. I think it's Article 25 of that regulation, around herd health programs, which depend on the, if you like, the type of animal, the size of the establishment, and so on and so forth, as to what is an appropriate health program. But you know, that by virtue of the fact that it's already in the legislation, it's a regulation, so it applies in every EU member state, that will probably act as a driver, I would think, for herd health programs in this country. But maybe the Department of Agriculture personnel will deal with that topic momentarily. In Ireland, the co-ops and licensed merchants have played a significant role in the distribution of veterinary medicines. How that will turn out to be in the next iteration of the national legislation, we have to wait and see. With Brexit, I understand that there's a need for veterinary certification of food exports going to the UK. Again, you know, certification is such an important, it's such an important and precise instrument that we need to know, you know, basically the how that food is produced, what products were used in its production, what veterinary medicines were used in its production, and so on. So I think that will also act as a driver. And then there could be an impact also of Brexit on veterinary medicines in Ireland. At the moment, we share about 50% of our products with a common label with the UK. Can we maintain that into the future? We will, as long as the UK maintains alignment with the EU. But our legislation is going to change from January 2022. The question is, will the UK change in parallel? And if not, how will that look like, and how would it affect veterinary medicines? I mentioned the product for exotic pets. These are defined as non-prescription products for treating aquarium or pond animals, caged birds, homing pigeons, etc. And you might see some of these products in your pet supply store currently. But currently these products are available without a marketing authorization. As a matter of fact, and they do so in many cases, having been advised to the HPRA. But the requirement of the regulation says that in future, they have to be manufactured according to good manufacturing practice. They are subject to controls. They are subject to pharmacovigilance obligations as per products that have a marketing authorization. They must be entered into the Union product database, so their SPC and product literature must be uploaded. And we've been in discussion with the Department of Agriculture, and we understand that the department will introduce a registration system. So this isn't an authorization system, it's a registration system. So they don't have to prove the safety and efficacy, but they will be subject to, as I say, the quality requirements, and they will have to provide a dossier in terms of, they will have to file a label, they will have to supply the SPC, and that information will have to be uploaded to the Union product database. So we're working with the industry right now to develop up those requirements for them currently. So then, Chairman, I'm just coming to the end here. So the take-home messages are that we would say that even as the EMA is offering through its computer databases. It's offering increased transparency. The immediate information on medicines will be reduced in the next few years. And again, we have this kind of like drivers for incentives for novel products and innovations. But you can see there's also maybe some increased regulatory requirements, particularly around human safety and around environmental safety. So what the net point will be, I'm not sure. But we can advise you to stay up to date with developments, particularly in relation to the new veterinary regulation, and you have the hyperlink there to do that. And with that, Colm, I'll hand back to you. Thank you for your attention, and I'll take any questions at the end. Thank you.
Sincere thanks, Gabriel, and you've covered a lot of ground there. I should have mentioned at the beginning for housekeeping that we will take questions at the end on all presentations. So if you send them in through the panel that you should have on your PCs, we can take those at the end. And also, I know for the amount of information there that Gabriel covered, we do plan on sharing all the slides at the same link that you would have accessed this webinar from, and the videos will also be online. I should have also mentioned that similar to last week webinar, which was associated with 2 CVE points, which have been validated by the BCI, tonight is also valid for 2 CVE points. There's also, tonight we were hoping to run 2 short polls. I'll open one now, if that's okay, and then I'll do the next one after Paul's presentation. Last week, I guess the presentation on the establishment of a national veterinary prescribing system piqued a lot of interest, and so we'd like to understand a little bit about your experience about using different software packages, and if we could confine this particular poll, please, to veterinarians or people who work in veterinary practices. The first poll that I would like to ask is, what veterinary software does your practice use? I think we have 5 different options there, so if you use none, for example, I think there's that option. So we'll open that poll now for the duration of Paul's presentation, and then I'll open the second poll after that. So sorry, Paul, I'll lead on to you now, and Paul's going to cover other aspects of the regulation other than prescribing.
Hi, Colm. Thank you for that. Can you hear me, Joe?
We can hear you, yeah. We can't see your screen. Sorry, Colm, do you want the poll to launch now? Or you have it now, yeah? We're seeing it.
Launch the chat. So do I need that to finish, Joe, before Paul starts up?
When you wanted to close, you just press on the close button at the side when you wanted to come off.
Oh, okay. Sorry. So I need to keep that on the screen until people answer.
Yeah, you keep it on for another 30 seconds or so.
And just to let people know, we will not be disclosing the results of this. Obviously, it could be commercially sensitive, so we won't be disclosing the results. If you are in a practice that doesn't use a software package, if you click on other, we will take that to be to also cover the fact that you don't use any software packages. So I'll just leave that another 10 seconds and then I'll close the poll. Okay, thank you everyone. We'll close that poll now and I will leave the floor open to Paul.
We're sorry, Paul. Yeah, your PowerPoint, we can see it now.
Oh, good. That's great, Joe. And you can see me as well, I suppose. Yeah.
Yes, yeah, we can see it.
Yeah, that's great. Listen, it's an exciting time to be the veterinary head of veterinary medicines division in the department, because there are big changes coming up. And I just was thinking this evening about when I qualified back in 1995 and how a residues directive came in shortly afterwards in '96 and how that changed things. Prior to that, we had been putting medicines into brown bottles and handing them out to farmers. And then we had to stick with the labeling and the bottles and the withdrawal periods. So I've no doubt that the changes that are ahead on this one will affect people equally. But many, as Gabriel said earlier, many of the changes are gradual, which is good, and we're fortunate. And the presentation here will focus on the changes other than prescribing. Last week, Caroline Garvin covered the prescribing and her colleagues. So just going over again what Gabriel said, the HPRA deals with labeling, changes to route of sale, the Union Product Database, and pharmacovigilance. And then you wonder, why is it that the department is involved at all? And the reason the department is involved is because we have the Veterinary Inspectorate on the ground to deal with distribution, wholesale, the wholesalers, the retailers, the storage, the usage, and proper disposal. And of course, without this, there would be no proper control over medicines. So there'll be changes in wholesaling, and there'll be additional standards required around the responsible person. There will be an EU-wide recognition of the wholesaler distribution authorization. We look at the retail articles, Article 103 or 104. The rules are remaining more or less the same. Internet sales are an option for prescription-only medicines, and that'll be something the department will be deciding upon. So this talk is going to focus on the legislation, really, and just so that you'll be able to follow it, recitals within the regulation are denoted by REC, and the articles ART. And we look at these, and the recitals are somewhat more interesting to read, but from a legal point of view, they're persuasive when it comes to interpreting the articles. The articles contain more of the legalese. One of the common misunderstandings that we've found when dealing with lay people is that they think that all veterinary medicinal products are the same. Many of the provisions within the new regulation apply to antimicrobials only. And in Article 1, you'll find the definitions for the regulation about what antimicrobials include. They include antiprotozoals, antivirals. It's all set out there. And if you want to see the classification of veterinary medicinal products, that's Article 34. So I move on to the next slide. This is a chain of distribution, and that's the part that the department is really concerned with. And it's a chain, and what that means is that it's dependent upon its weakest link. So if you look at Recital 64, it says, that it is necessary to exercise control over the entire chain of distribution of veterinary medicinal products from the manufacture or import into the Union through supply to end user. So all the ways along that chain. Veterinary medicinal products from third countries should comply with the same requirements which apply to veterinary medicinal products manufactured in the Union, or with requirements which are recognized to be at least equivalent. And we always, make contact. We have a great relationship with the HPRA. And if there's something being imported from a third country, which the UK is now as well, very close to us, we will always find out from the HPRA whether the standards are acceptable there. So if I look at another recital, Recital 71, good distribution practice. Companies should hold an authorization to be able to distribute wholesale veterinary medicinal products and should comply with the principles of good distribution practice so as to guarantee that such medicinal products are appropriately stored, transported, and handled. It should be the responsibility of the member state to ensure that those conditions are met. Those authorizations should be valid throughout the Union and should also be required in case of parallel trade in veterinary medicinal products. Gabriel mentioned parallel trade earlier. So we basically have to ensure that that there's good practices involved throughout. And we can see what happens with the vaccine, with the COVID vaccine here. Already we've seen cases where it hasn't been stored properly at the right temperatures. and the product is no longer effective. So if we look at Recital 73, it mentions the conditions governing the supply of veterinary medicinal products to the public. It should be harmonised throughout the Union and supplied by persons authorised to do so by member states. So you know here in Ireland that yourselves, vets and licensed merchants and pharmacies are authorised to supply these products. At the same time, in order to improve access to veterinary medicinal products in the Union, retailers that are authorised to supply veterinary medicinal products by the competent authority in the member state in which they are established should be allowed to sell veterinary medicinal products not subject to a veterinary prescription at a distance to buyers. So here is the article where it's talking about sales at a distance. So that's another relatively new aspect to all of this. And I suppose in the COVID has shown us that society is moving in this direction. So will sales at a distance be a big feature if it's introduced, especially for prescription-only medicines? Requirement to keep veterinary records, and this will be a big part for us. And Recital 74 there says, vets should always issue a veterinary prescription when supplying a veterinary medicinal product subject to a veterinary prescription only and not administering it themselves. However, whenever the veterinarian administers such a product themselves, it should be left up to national provisions to specify whether a veterinary prescription needs to be issued. However, veterinarians should always keep records of the medicinal products that they have administered. So last week we spoke about the Peter Collins spoke about the electronic prescribing system, and it'll have to be recorded in any event if you give a prescription-only medicine, if you administer it. So it'll be up to Ireland to decide upon whether or not a prescription will be needed when you're administering the product, but the details will need to be recorded in any event. Then the requirement to dispose of product. Recital 78. Collection systems for the disposal of waste veterinary medicinal products should continue to be in place in member states in order to control any risk that such products might raise with regard to protection of human and animal health or the environment. And Gabriel mentioned this in his talk, that the focus is on what happens to the product when it gets into the environment. The requirement to restrict advertising. Have a look at Recital 79 there. Advertising, even of medicinal products not subject to a veterinary prescription, could affect the public and animal health and distort competition. Therefore, advertising of veterinary medicinal products should meet certain criteria. Persons qualified to prescribe or supply veterinary medicinal products can properly evaluate the information available in advertising. They cannot, because of the persons involved in the prescribing or supply can properly evaluate the information because of their knowledge, training and experience in health. The advertising of veterinary medicinal products to persons who cannot properly assess the risk associated with their use may lead to medicinal product misuse or overconsumption, which is liable to harm public or animal health or the environment. However, in order to preserve the animal health status in their territory, member states should be able, under restricted conditions, to allow advertising of immunological veterinary medicinal products also to professional animal keepers. So in the Farmer's Journal, you'll find lots of advertisements for vaccines, and that's provided for in it. However, you won't find the same advertisements for prescription-only medicines. And with the antiparasitics going prescription only as well, you'll find less advertising now in the Farmer's Journal. You won't find it there when they're prescription only. And this is to avoid pressure being applied by people who don't have the proper knowledge and training and experience here. So I'm going to look at Article 57, talk about Article 57. It's talking about tracking antimicrobial usage by species. And I mentioned that the timelines in the regulation are gradual. I want to perhaps remind you of the differences between tracking sales as we currently do, sales data that we feed into the European surveillance of veterinary antimicrobials. The EMA run a database on that, and that's how we track it. And the acquisition of that data is voluntary at the moment. The HPRA do it, and it's sales data. We're moving to a situation where it will be prescription, that prescribing data, and that's what the national e-prescribing database will allow for. It will allow us to provide the data in that form back to the EMA, which will be a legal obligation. And in some cases, it will go down to usage data. So the EMA has, if you look at their website, you'll find what they believe. They've been asked to advise the Commission and their document as to how the usage data should be acquired from member states is up on the EMA website. So as regards the timelines, for cattle, pigs, chickens and turkeys by 2024, this reporting will have to take place. And as Gabriel has highlighted already, a lot of this information will be widely not only visible to the public, but they'll be able to do analysis on it as well. There'll be tools to analyze the data on the website. So it'll be very transparent, and that's all part of the EU push on transparency. By 2026, you'll have all other food producing animals. And for those colleagues on the call who are on companion animal only, by 2029, the usage data for antimicrobials will have to be recorded there as well. Now, looking at the record keeping that owners and keepers of food producing animals are required to keep, it's already there. There is already a requirement for them to keep records in national legislation, but here it is now in EU legislation as well. And Article 108 says that where owners or where animals are not kept by their owners, keepers of food producing animals shall keep records of the medicinal products they use, and if applicable, a copy of the veterinary prescription. So on farm, what they will be expected to have is the prescriptions that you will issue to them. And Article 108.2 actually details the records that they will have to have: the date of the first administration of the medicinal product to the animals, the name of the medicinal product, the quantity of medicine administered, the name or company name and permanent address of the registered place of business of the supplier, evidence of acquisition of the medicinal products they use, identification of the animal group or the animal or the group of animals treated, and this will be important for the metaphylactic and prophylactic use provisions we spoke about last week. The name and contact details of the prescribing veterinarian if applicable. Note that it only mentions veterinarian, therefore prescribing, and withdrawal period even if such a period is 0, the duration of the treatment. Now, there will be additional record keeping obligations for equine animals, and Article 109 deals with that, and it relates to where products are used where there's no withdrawal periods, that where the passport gets stamped out, and it talks about the single lifetime identification document. So I suppose I could spend a lot of time talking about this, but for tonight, just for equine practitioners out there to know that there's a more onerous system in place for record keeping for equine animals. Now, because of the Article 105, which relates to prescribing, that was discussed in great detail last weekend, because of this article, from the point of view of the department who are going to be regulating what's present on farms, we expect to see far less antimicrobials stored on farm. This is because a prescription 105.2, the vet will have to provide justification for the prescription, and that's a requirement to put down a diagnosis really when you're prescribing antimicrobials. A veterinary prescription shall be issued only after a clinical examination or any other proper assessment, and last week the Veterinary Council, Niamh Muldoon, went through that. And Article 105.5 as part of the prescription, the dosage regime is required. And 1056, the quantity of medicinal product prescribed shall be limited to the amount required for the treatment and therapy concerned. And Gabriel mentioned that there are changes coming to package sizes as well. There'll be an obligation to provide as close as possible to the quantity required for the treatment, the condition you're treating or the treatment. And this leads me on to the next slide then, which follows on that the code of good practice regarding responsible describing, in that it deals with the proper disposal. This was dealt with, the 6 R's. So do not hoard, partly use medicines are the guidelines for farmers. So if you issue a product, an antibiotic treatment for a treatment course, what remains, that unused part of the medicine should be disposed of properly. It shouldn't be used to treat the next animal. So we'll be expecting that there'll be lots more out of date or remain the end of a treatment, or let's say an animal dies during the treatment. The product that's left hasn't been prescribed for any other animal and is unused and will have to be disposed of. And in this the 6 R's, it says that all out-of-date medicines, containers, and application equipment, including needles, sharps, and so on, are dealt with as in clinical waste containers when you finish the treatment for which they were intended, and that these items should never be disposed of in domestic rubbish, because it all contributes to contamination of the environment with your antimicrobial. And that they shouldn't be poured down the drain. I mean, this is quite obvious, but it's stated in the 6 R's that this in relation to the right disposal. And it's important that these changes are communicated to your clients. So if we look at Article 123, it deals with inspections and controls. And of course, this is the bread and butter of the department. Where would the department be without inspection and controls? So the department is meant to introduce across the whole distribution chain a system of controls, and some of them must be unannounced, and they include the owners and keepers of food-producing animals. And then in Article 124, it speaks about audits that will be performed by the Commission. All of this, of course, involves changing behaviour, and the Commission recognises this well, and so does the EMA. And they talk about getting vets and farmers to think differently about the use of antimicrobials, rather than merely following their standard practices acquired over many years' experience. And I, over the last few weeks, have asked different colleagues about the remainder, the antibiotic that's left over in the 100cc bottle after treatment. And some of them amazed me, like they said that would be so wasteful to consider that unused antibiotic that it should be disposed of. Well, that's what the Commission wants. That's what's required here. A real change in how you think about antibiotics, and how to tackle antimicrobial resistance through the prudent use of antimicrobials in animals. Go on to the next slide. Then, if you have the time, if you can read this, if you put it into Google, DG Sante report, there's a final report there relating to the research that was carried out across 5 European countries, not all in the EU, but in the EFTA. Norway is one of them. Norway considers itself, its claim is that it has the highest proportion of bacteria sensitive to the most antimicrobials in Europe. And so they find that they're using the first line antimicrobials. They're in Norway, most frequent used are the narrow spectrum penicillins and the class of antimicrobials for food producing animals. And the vast majority of the antimicrobials marketed were for the treatment of individual animals. So Norway is kind of seen as the leader of the pack. That now you might say, well, isn't it all fish up in Norway? But they do have some agriculture there as well, and they take great pride. And its pride in having the most sensitive antibiotics, so they have the least resistance. Latvia, then, if you look at what all the different countries are doing different things here to try and fight antimicrobial resistance. And I saw in the American Veterinary Medicine Association this week, they defined what a vet does. And, the usual things are there, like food safety, animal health, animal welfare. But one of the things that's there as being one of the 5 pillars of veterinary now is fighting antimicrobial resistance. It's that important. And in Latvia, what they're doing is they're developing guidelines containing a list of antimicrobials of choice to prevent the most prevalent diseases. So they're doing up a list of, and this is to assist practitioners in what they will prescribe in the various situations. So I'm sorry, now coming nearly to the end. I suppose this is an important point to remember. The European Commission, and Gabriel mentioned it with the farm to fork strategy and using the 2018 figures and wanting a reduction of 50% across the EU. They're really serious about this piece of legislation, and they've made it clear that they're going to audit countries very consistently. However, they have it said in this recital, which is the final recital. There are 97 recitals in total. I'll read it out because it's important. They said, since the objectives of this regulation, namely to establish rules on veterinary medicinal products ensuring the protection of human and animal health and the environment, as well as the functioning of the internal market, cannot be significantly achieved by the member states. If it cannot be achieved by the member states, but can rather by reason of its effects be better achieved at union level, the Union may adopt measures in accordance with the principle of subsidiarity as set out in Article 5 of the Treaty of European Union, in accordance with the principles of proportionality as set out in that article. This regulation does not go beyond what is necessary in order to achieve those objectives. So it's a threat, really. It's if member states aren't prepared to deal with antimicrobial resistance, the Union will take it upon themselves to do it. It's that important. And I think that's a good point to end on. Sorry if I bored you with some of the articles, but it is the only way to get to know this this change that's coming upon us. And if you go to Google, put in regulation 2019/6, the entire regulation will come up in front of you. And that's what people are doing. And I'd urge you to do it because the changes for the profession are very widespread. Thank you very much. Colin, I hand back to you.
Sincere thanks, Paul. And again, we've covered a lot of ground there, which we can cover in questions and answers at the end of the presentations. I said I wanted to ask a second poll after Paul's presentation, so I'll just run that for about 90 seconds again, like we did before Paul's presentation. So if you use a software package, do you record your prescriptions? And if so, do you do that either by your practice computer or do you have access to a mobile app, which you can do it through? That is the purpose of the poll. So we'd appreciate your responses, please, in the next 90 seconds. Thank you.
We've just lost your
Thank you very
sound,
much.
Colin.
Yeah,
Oh,
thank
you're
you.
back.
Thank you very much for filling that out. That's great. And our last presentation of the night, and apologies, we are running a little bit over time, but I guess you can see the breadth of knowledge we're trying to get through. So as well as the regulation we've spoken a lot about, 2019-6, there is a second regulation being introduced at the exact same time. It's a smaller piece of legislation, and it's specifically related to medicated feed, which, as I said at the outset, would have particular interest for those of you engaged in the intensive production sectors. And Eva Gethens, a veterinary inspector here in the department, will lead you through it. Over to you, Eva.
Thanks, Colin. So good evening, everybody, and thank you for joining the webinar tonight. In my presentation, which will be a shortish presentation, I hope to cover some of the changes for the veterinary practitioner that is prescribing medicated feed under the new Medicated Feed Regulation, so EU Regulation 2019-4. So I'm actually going to turn off my camera and just leave the presentation on the full screen, if that's okay. Have that done? So this regulation comes into force alongside the Veterinary Medicinal Product Regulation, which my colleagues have discussed at last week's webinar and tonight. And the changes under the Veterinary Medicinal Product Regulation do follow through into this new Medicated Feed Regulation also. And the two regulations do have very much aligned objectives. So I'm just trying to move on to the next screen now, sorry. That won't move on there, Joe, I don't think for me. Oh, here, sorry, there we go. Okay, so what I'm going to discuss in this presentation is the place for medicated feed and why it might be prescribed, the legislation, so both the existing legislation, which will be repealed next year, and the new regulation, and what the objectives of this new regulation are. I'm going to discuss the specific changes which will impact the veterinary practitioner who's prescribing medicated feed, and also just give a brief overview of some of the changes under this regulation that are more relevant to the manufacturers of medicated feed. So what is a medicated feed? So a medicated feed is a feed which is ready to be fed directly to animals without any further processing. And it consists of a homogeneous or a well-mixed mixture of one or more veterinary medicinal products, which are called medicinal premixes, and they're authorised and they're intended for this purpose of incorporation into feed or intermediate products with feed materials or compound feed. And just to explain an intermediate product, so an intermediate product is a mixture of a medicinal premix which is mixed with some feed material, which might be a mineral mixture, but it's not yet ready to feed to animals before being incorporated with further feed materials. So feeding medicated feed is one of the routes for oral administration of veterinary medicinal products to animals, and it is certainly a stress-free way to safeguard farm animal health and welfare. Medicated feed is generally used to treat animal disease in large groups of animals, so such as intensively reared pigs, poultry or fish. And it can assist good husbandry, biosecurity and management on farm. So it can have a place, but it should not replace that, and that's important. So one of the main concerns regarding this form of administering medication is the risk of development of antimicrobial resistance. And there is much evidence to support that this oral administration of antimicrobials can be problematic in that regard. So with that in mind, the safe and prudent use of medication in this form is really important. So what are the regulations then covering medicated feed? So the current regulations covering medicated feed are Council Directive 9167 EEC and SI number 176 of 1994. So this legislation all dates back to the 1990s, which was before the creation of the internal market. So it's well overdue being updated. And both the farming industry and the feed industry have adapted and changed over that time. So at the time when that legislation came in, on-farm mixing of medicated feed wasn't a common practice. And that has become more common over time, and this new regulation addresses that. So these regulations, the older regulations that are currently in place, will be repealed in January 2022 and replaced by a new European regulation, which is EU Regulation 2019-4. And that regulation comes into force on the 28th of January 2022. So it's less than 1 year from now, about 9 months from now, and it comes in at the same time as the new Veterinary Medicinal Product Regulation. The regulation is binding in full on every EU member state, and there are only limited areas of national discretion. We will have a national SI, but it would likely be quite a short SI because there are very few areas under this European regulation of national discretion. The EU regulation on veterinary medicinal products, which is EU Regulation 2019/6, and this regulation have very much aligned objectives, which I'll go through. So what are the objectives of the new regulation? So the main objective, I suppose, of the new medicated feed regulation will be to harmonise the manufacture and the use of medicated feed throughout the EU, and that was desired. The regulation, or both regulations, aim to ensure a high level of protection of human health, and it aims to limit the development of antimicrobial resistance. The new medicated feed regulation will aim to prevent cross-contamination of medication into non-target feeds by laying down cross-contamination limits for the manufacturers. It will allow for the possibility to treat non-food producing animals with medicated feed, and that's a new provision in the regulation. Environmental risks will be addressed, and there will be a legislative requirement for the safe disposal of unused or expired medicated feed. Both regulations will actually aim to facilitate intra-union trade, and that should in turn actually improve the availability of essential veterinary medicinal products to protect animal health and welfare, while also ensuring that they're used safely. So what are the key changes then under the veterinary medicinal product regulation? So some of the changes are kind of more applicable to the vet prescribing the feed, others more applicable to the manufacturer actually manufacturing the feed. But the main changes summarised are there will no longer be veterinary written directions, and instead a vet will now write a prescription for medicated feed. There will be changes to the validity periods of prescriptions, and that 31-day validity period, which we would have been familiar with for VWDs, it won't apply any longer. It will be prohibited to administer medicated feed to animals prophylactically or for the prevention of disease. There will be provision for the use of medicated feed for pets or for non-food producing animals, and as I mentioned, that's a new provision. Cross-contamination limits from the manufacturers will be set, and disposal requirements for medicated feed will be laid down in the regulation. So VWDs, the veterinary written directions, will no longer exist, and a veterinary prescription will now be required when prescribing medicated feed. Annex 5 of the regulation lays down all the details that are required to be included in a prescription for medicated feed, and I'm going to go through those requirements in more detail and compare to what the current requirements are for the VWDs. There will be changes to the validity period for prescriptions depending on the veterinary medicinal premix which the medicated feed contains, or the animal type for which the medicated feed will be administered. And as for prescriptions for veterinary medicinal products, the prescriptions for medicated feed will now be recognised throughout the European Union. So prior to the issue of a prescription for medicated feed, it will be required to carry out a clinical examination or a proper assessment of the animals to whom the feed will be administered, and a prescription may only be issued following diagnosis of a disease. So by way of derogation from that, the regulation does state that medicated feed containing an immunological veterinary medicinal product or some antiparasitics may be prescribed in the absence of a diagnosed disease. So there may be some scenarios where it's not possible to first actually diagnose a disease. Similar to the current situation with VWDs, a veterinary prescription for medicated feed will be issued in triplicate, so with the original held by the manufacturer of the feed and copies held by the practitioner and the keeper of the animals. And these must be kept as records for a period of 5 years as opposed to 3 years for VWDs under the current regulations. It would not be permitted to prescribe medicated feed containing more than one veterinary medicinal product containing antimicrobials, and prescriptions written must be in compliance with the summary of product characteristics for the premix, and that's except for veterinary medicinal products that are used in accordance with Articles 112 to 114 of EU Regulation 2019/6, and those articles refer to the cascade type provision under the current veterinary medicines regulations. So I've mentioned the changes to the validity periods of prescriptions depending on the veterinary medicinal product which is prescribed, but just to go into kind of further detail on that. So for non-food producing animals, except for fur animals, a prescription for medicated feed may be valid for a maximum period of up to 6 months. For food-producing animals and fur animals, a prescription for medicated feed may be valid for a period of up to 3 weeks. But for a medicated feed containing an antimicrobial, that prescription will only be valid for a period of 5 days. And that's very similar to the Veterinary Medicinal Product Regulation. And what that means is that from the date of issue of the prescription for a medicated feed, that medicated feed must be dispensed within that period, within 5 days. So with regard to the duration of treatment, this must comply with the summary of product characteristics, but where that's not specified, it must not exceed 1 month, or in the case of medicated feed which contains antibiotics, it must not exceed 2 weeks. So the details which must be included in a veterinary prescription for medicated feed are laid down under Annex 5 of the new regulation. And much of the details are actually quite similar to what the current requirements are for a VWD. And there are just some additional details that are required, and just to compare and contrast those. So the regulation, also just to mention, the regulation does state that the Commission may, by means of implementing acts, set out a model format for a prescription for medicated feed, be that in electronic format or otherwise. But there hasn't been kind of a further update on that at this time, but that may come down the tracks. So the name and address of the supplier will be completed under a section to be completed by the manufacturer. So all the requirements for the prescription, the new veterinary prescription for medicated feed, are on the right, sorry, here, which is highlighted in blue. And just on the left, I have the in this table the requirements, the current requirements for a veterinary written direction, which are detailed under the first schedule of SI number 176 of 1994. So the name and address of the supplier will be completed under a section to be completed by the manufacturer. The name and the contact details of the animal keeper and the identification of the establishment is required where that exists. The identification of the animals by category, species and age, and the number of animals to be treated must be detailed. The detail of the veterinary medicinal product, including the authorization number and the active substances for the veterinary medicinal products prescribed under Articles 107.4 and Articles 112 to 114. It's required to have a statement to that effect on the prescription. So again, the Articles 112 to 114 are referring to the cascade type provision. The quantity of medicated feed and the inclusion rate is required. The diagnosed disease to be treated, but in the case of an immunological veterinary medicinal product or antiparasitics without antimicrobial effects, the disease to be prevented is detailed. The quantity of medicated feed to be administered daily and the duration of treatment. For food-producing animals, the withdrawal period must be stated, any warnings, and where relevant, a warning to ensure the prudent use of antimicrobials. The full name and the contact details of the vet, including the professional number, signature or electronic form of identification, the unique number of the prescription and the expiry date. Under Annex 5, it states that for food producing and fur animals, the prescription should mention the statement, "This prescription shall not be reused." So that's a new requirement. In the section to be completed by the supplier then of medicated feed, the name or the business name or address must be detailed, the date of delivery or the date of on-farm mixing, the batch number of medicated feed delivered under prescription, but that doesn't apply to an on-farm mixer, and also the signature of the supplier. So my colleague Peter Collins gave a presentation on the new National Veterinary Prescription System last week, but just to mention it here again because it does apply to medicated feed. So this is an electronic prescription system which will come into effect alongside the new regulations, and it will enable the vet to generate prescriptions for medicated feed as well as prescriptions for veterinary medicinal products on a mobile app, a tablet, or on an online website or portal. And this system should greatly facilitate record keeping, both for the farmer and the vet, and it will facilitate also our national obligation to submit veterinary medicinal product usage to the Commission in accordance with Article 57 of EU Regulation 2019/6. So Article 17 of the Medicated Feed Regulation lays down the requirements regarding the use of medicated feed. And it states under this article that medicated feed containing antimicrobials shall be used in accordance with Article 107 of Regulation EU 2019-6 and shall not be used for prophylaxis. So that's a significant change. And just to kind of refer back to Article 107 of Regulation EU 2019-6, that article is referenced in a number of places in this regulation, and that article refers to antimicrobial medicinal products not being used to compensate for poor hygiene or inadequate animal husbandry. The use of medicated feed for metaphylaxis will be permitted, but only where the risk of infection or an infectious disease is high. So there are many changes also in the regulation that are more relevant to the manufacturer, and just to kind of highlight some of those which are important. So criteria with regard to homogeneity will be set. So that refers to how well mixed the medication is throughout the feed, and that has a direct impact on the dosage that each animal consuming that feed will receive. Maximum levels of cross-contamination will be determined following a risk assessment carried out by the European Food Safety Authority in conjunction with the European Medicines Agency. And that risk assessment has commenced, and the delegated acts will be adopted by January 2023, laying down the maximum levels of cross-contamination established from that risk assessment. And firstly, it will look at 24 active substances that are listed under the second annex to this regulation, but it may follow on to look at further substances then in time. There will be a requirement to ensure that appropriate collection and discard systems are in place for medicated feed which is expired or has been unused. Specific requirements for a quality system are detailed, and Annex 1 of the regulation details the requirements regarding acceptable facilities, equipment and personnel, etc. for the manufacturers. Specific labelling requirements for medicated feed are detailed under Annex 3 to the regulation, and there are some changes there, mainly in the form of warnings that must be included on the labelling, and warnings now to help to improve the awareness of the end user of antimicrobial resistance and the risks to the environment if a medicated feed was to be handled or disposed of incorrectly. So just some key takeaway messages or some of the main points under this regulation. So there will no longer be veterinary written directions, and from January 2022, a vet will now write a prescription for medicated feed. There will be changes to the validity period for prescriptions depending on the veterinary medicinal product which that medicated feed is to contain, and depending on the animal type for which the medicated feed is intended. But for any medicated feed which contains an antimicrobial, that prescription will only be valid for 5 days. There will be restrictions on the use of medicated feed, and medicated feed containing antimicrobial veterinary medicinal products will not be permitted for prophylaxis from next year. So if anyone has any queries or questions on either of the new regulations, I think questions and queries can be directed to this email address, vetmedregs@agriculture.gov.ie, and any of us in the veterinary medicines team would be happy to try answer any queries that anyone has. And I can leave that there for a bit if anyone wants to take it down. But other than that, thank you very much for listening, and I hope some of that information has been useful. So that's me.
You're on mute, Colin. Colin, you're on mute.
Sorry, Colin, we can't hear you there. If you can just unplug your headset and plug it back in again. Thanks.
Okay, now.
Yeah, we can hear you now, yes.
Oh, perfect. Apologies for that, folks. I know we did say that we'd aim to finish up at 8:30, so apologies, we have ran over. But I think out of respect for the people who have asked questions, and I know there's well over still 380 people on the call, so look, I think we'll go through a few of the questions. But obviously, if you had only scheduled whatever time you have in your personal life or whatever to finish up at 8:30, thank you for being with us. And all the presentations will be made available on the department's website. Go to the same link that you accessed tonight's webinar from. The videos from tonight and last week are also at that link, and you can also find them on the department's YouTube channel. So please feel free to access that, or equally, if you have any further questions, please send them to that email address that Eva just put up there, vetmedregs@agriculture.gov.ie. I'll repeat that again at the end. So I want to thank our speakers for coming back on the video here. We have Eva, Paul, Dr. Gabriel Beechner, and Peter Collins, who presented last week. So I'll just run through a few of the questions that we have from people, and thank you for sending in your questions. Eva, I guess while you're still there, fresh from your presentation, I have a question here. We frequently use a veterinary medicinal product that we buy in Ireland, but it then has to be sent to the UK to be mixed into feed and re-imported into Ireland as medicated feed. There are no options to produce the medicated feed in Ireland. The question is regarding the 5-day validity of the prescription. Does this refer to the time we have to buy the product in Ireland, or would this be applicable to the re-import of medicated feed?
Yeah, so just I suppose, first of all, to answer what the 5-day validity period means. So that means that from the date of issue of the prescription to supply or dispense of the medicated feed must take place within 5 days. I think this question is referring to a medicated fish feed, and we currently have no manufacturers of medicated fish feed in Ireland, whereas there are specialised fish feed manufacturers in Scotland or in parts of the UK. And there is one particular premix, which is Slice, which it states in the SPC that that product must be manufactured at a commercial fish feed manufacturer. So as we don't have any of these commercial manufacturers here in Ireland, obviously it is required that that will be imported. And there is provision in both the current regulation and the new regulation for the import of feed. But that 5-day validity period does stand. It does depend on the product, obviously. So Slice, that particular product, is actually an antiparasitic. So if that is the product that has been referred to in this question here, the validity period for the prescription there would actually be 3 weeks, because it's an antiparasitic as opposed to an antimicrobial. And that should be a sufficient time really for issue of prescription, issue of an import license, and import of the feed. It has come to our attention that that 5-day validity period may be slightly problematic in some regards, and just it has been mentioned to us that storage capacity on farm could be an issue. So at the minute, a veterinary written direction is valid for 31 days, and it wouldn't be uncommon for a feed mill to actually dispense the quantity of medicated feed allowed on that VWD in 4 batches during that 31-day period. And obviously now for a medicated feed containing an antimicrobial, that will need to take place within 5 days. So some of these issues are coming to our attention, and there is ongoing discussion as to how it's going to work. I suppose we do anticipate that the regulation is going to bring about some changes in the current practices. So I hope,
okay, thank you very much, Eva. I would say to the individual who asked that, if you want to follow up more specifically, we're happy to take that. And again, the email address is vetmedregs@agriculture.gov.ie. Gabriel, here's one for you. If the VPO VSO classification no longer exists, how will these restricted medicines be identified?
Thank you for the question. Yeah. So there will be a statement probably on the package leaflet. So the product can only be administered by a vet. That will still be a statement on the package leaflet. We are looking as well at the union product database to see whether or not the products can be identified, those products that are restricted for use by a vet or under a supervision, his or her supervision. We're looking to see if we can, if there can be a field in the union product database that will that you can search on for them as well, but we're not sure whether that still is being considered by the European agency. Thank you.
Thank you, Gabriel. Another one here. I have a practical query. This country is missing probably 100 vets at the moment. It will need even more farm vets to be able to cover and attend all sick animals and prescribe medication. Where those additional vets will come from, that is going to be a big problem. I think you know, we referred last week to the prescribing requirements, and really in order to issue a prescription, a vet will be required to undertake a clinical examination or a proper assessment, or any other proper assessment. And when we're not talking about antimicrobials, there is also national discretion about how long a prescription can be valid for. So it possibly could be valid for several months. I also know from engagement with the Veterinary Council, we now have the highest number of vets on the veterinary register in Ireland in our history. So I think we have a substantial number of vets, and we are also looking for a pragmatic and practical implementation of the regulation insofar as the requirement for vets to visit on farm. So those sort of decisions will be elaborated in the next few months as we continue our stakeholder engagement. It is also an action under the National Farmed Animal Health Strategy to look at the availability of vets in rural areas for large animal practices. So it is something that the department is actively looking at. So I just want to reassure the person who asked that question that it's something we're very conscious of, and will take steps to address if a specific problem arises. Another question for Eva. You've stated that the maximum duration of in-feed treatment with a veterinary medicine product for a food-producing animal is 2 weeks. But some products, e.g. Tylen, have a 21-day treatment recommendation listed on their SPC. Will the SPC change, or will there be an exception to this 2-week rule? And perhaps you already covered that, Eva.
Yeah, no, I think that is, if it's not specified in the SPC, it must not exceed 2 weeks for an antimicrobial, but where it is specified, it should be in accordance with the SPC.
Okay, thanks, Eva. Peter, one for you. Will farmers have access to the NVPS and other systems such as the EU product database?
Certainly.
And maybe the EU product databases for Gabriel, but if you want to speak about the NVPS.
Yeah, the NVPS obviously involves 3 actors, which one would be the farmer, one would be the vet, and one would be the dispenser of the medicine. So the idea is that the vet will send a prescription or an email, an SMS to the farmer himself, so he'll get access to his prescription that way. But we'll also be producing a portal access for the farmer, so he can see what medicine, what prescriptions he's been given. That's the only access currently at the moment that we see for the farmer within the NVPS. The Union Product Database, I think Gabriel can answer that.
Yep, sure. So basically the public will have access to the Union Product Database, but they'll have access to certain fields. The authorities and the companies will have greater levels of access. So for example, we can look at searching, for example, for signals and adverse reactions for products through, all fluoroquinolones or through certain types of antibiotics or whatever. Whereas the public will have access to maybe general queries and limited search functionality. So in other words, they will be able to maybe match terms and get certain hits from that, whereas we will have more in-depth levels. But basically the public access and veterinarian access will be largely similar, I expect. Thank you.
Okay, thank you, Gabriel. Eva, I see another one here for you. Concerning medicated, be permitted to feed coccidiostats to calves, for example, for greater than 1 month?
So again, I think the duration of treatment must comply with the summary of product characteristics, but for antimicrobials then not exceeding the 2 weeks, and other products not exceeding 1 month, I think is what I said. I can't remember now what I said in my presentation. But so yeah, again, kind of along the lines of the SPC, it must comply with the SPC.
Okay. That we
I think your sound has gone again, Colin. Joe?
Yeah, we've lost your sound again. Just might have to disconnect and reconnect.
is that back now?
Yeah, it's back now, yeah.
Yeah, so apologies about that. I guess that's the signal to finish up. I just want to thank everyone for their time tonight. We had close to 400 people online tonight and more than 500 last week. So I think that signifies the level of interest we have in new veterinary medicine regulations. I want to sincerely thank all of you for tuning in, and I also want to really thank all of our speakers. Tonight we had Gabriel, Eva, Paul, and last week we had Caroline Garvin, Peter Collins, apologies, my memory's gone blank, Niamh Muldoon of the Veterinary Council, and Finola McCoy from Animal Health Ireland, and I hope you found them useful. We put a lot of thought into the programme of presentations to make them as useful to you as we possibly could. As I said earlier, all the presentations and the videos from last week and this week will be available on the gov.ie webpage, on the same page you access tonight's presentation. And if you have any further questions, please give us an email on vetmedregs@agriculture.gov.ie. These regulations, as you know, are effective from next January 2022. As we've said, this is the biggest change to regulation of veterinary medicines in a generation. There is significant change, which I hope we have managed to get across. The department is committed to further stakeholder engagement over the next 9 months and beyond to work with you and other stakeholders. As you know, there's significant public interest in the regulations, as demonstrated by 3 Oireachtas committee hearings on them to date, and I think another one scheduled for later in the month, and also extensive media coverage. So these are extremely important, and in your role as prescribers, you are at the forefront of being responsible for the prudent use of medicines, and we thank you for that. And with that, I'll sign off, and again, thank you to all our contributors. Hope you have a good evening.